Welcome to the Relationships Inside Out podcast with Doctors Gregory Siebert and Kimberly Murray, licensed marriage and family therapists. Join them on this journey as they explore the ins and outs of relationships.
Well, welcome to Relationships Inside Out, where today we have a very special guest, Tanja Gorenc. She's a licensed marriage and family therapist who specializes in neurofeedback.
Welcome.
Welcome, Tanja.
Thank you. Thanks.
Yeah, tell us a little bit about yourself and neurofeedback and how you got into that.
Yeah, so I am a marriage and family therapist. I kind of started school to see couples and was then hired at a practice that did neurofeedback. I had no idea what it was. And so I kind of got into it that way. I experienced a little bit of anxiety myself, and that my employer allowed me to do neurofeedback because I wasn't really super keen on that. I didn't know anything about it. I had no training in it. And I thought to myself, like, there is no way that this works. And so I am going to try it myself. And yeah. So I honestly just ended up doing it on myself, and it pretty much didn't take my anxiety away all the way, but I am not having panic attacks rocking on my bathroom floor anymore. So I count that as progress. And so to me, it felt very like I could see tangible change. And so using neurofeedback in conjunction with my talk therapy clients, I saw tons of progress very quickly. And so for me, that's really important, is to be able to see change quick. So that's kind of how I got into it. And now I have a group practice with 8 therapists and 3 interns. And so we kind of focus on the neurodivergent population in our practice and see individuals and couples and families.
Do you care sharing what neurodivergent means?
Yeah, so things like ADHD and autism fall within the neurodivergent term. It's just, I like to think of it as just people's brains being wired a little bit differently than like a normal, right, person.
I asked that because I feel like there's a clinical kind of parameters for neurodivergence, and then there's everyone and thinks they're different, so they're neurodivergent. So I just wanted to clarify,
right.
And so tell us a little bit about that process that you even went under yourself and what that even looks like. What, because this isn't talk therapy, as you said, right? Before, when we've talked outside of here, you've talked about it's not really talk therapy. So I would love to hear more about what that process looks like. Somebody interested in it, what could they expect?
What is neurofeedback at its core?
Yeah. So neurofeedback is a way to train your brain to essentially function more efficiently. So it's very different from talk therapy because we're not doing a lot of talking. In our practice, the way that it works is the very first thing you do is we do an EEG of your brain. We call that a brain map. So that is going to tell us how your brain is functioning. Is it producing too much of a brainwave, not enough of a brainwave? Are there both things going on, right? Are there parts of your brain that feel pretty balanced and then parts that don't? And then from there, we can tailor a protocol that's individual to each client's brain. And so we, in our work, take what the client is coming in verbally reporting they want to address, right? So maybe it's anxiety, maybe it's emotion regulation, maybe it's sensory sensitivity stuff. And then we look at the data that we collect on that brain map and we can formulate a plan. And from there, we determine, what area of the brain are we going to train? And then exactly what brainwaves are we going to train? So if your brain is producing too much of a brainwave, we're going to ask it to not do that, right? To produce less of that brainwave because you don't need that much of that one maybe. Or if it's not producing enough, we're going to ask it to produce more because you need more of that brainwave in order to kind of reduce some of the symptoms you're experiencing. And so, I think a lot of people confuse neurofeedback with like shock therapy because they've got sensors on their heads, and it's not. So neuro is completely painless. It's totally non-invasive. You do wear sensors on your head, but the sensors just read the brainwaves at that location. So there's no like pain, there's no electric shock. We're just reading in real time what your brain is doing. So, in a typical session, you come in, we do a check-in, so it's not completely silent, but we're not doing tons of processing through like, how your day is going, kind of addressing those types of issues. We're looking more at how are you doing in terms of neurofeedback progress, right? What might your anxiety feel like this week? Or what might your attention and focus look like at school? Sometimes for kids, we'll ask about grades. How were your grades? How did you do on this test? To kind of measure, are we doing anything or not, right? And so after the check-in, we hook you up to the computer. And so the sensors, in our practice, you usually wear anywhere from 1 to 3 sensors on your head. And so we'll attach those to the head at the specific location, which then attaches into like a head box on the computer. And so from there, the therapist will set thresholds for all of the specific brainwaves that we're training. And the goal is always to get the brainwaves as close to their ideal thresholds as possible. So when the client is in the room, they're watching a game on a computer screen. And when the brain does what we want it to do, which is either increase specific brainwaves or decrease others, the game will then do something different. So, for example, they might be watching a car driving down a track. And so when the brain does what we want it to do, the car will ride in the middle of the road and it will look very smooth. That's feedback to the brain saying, yes, you're doing it correctly. Keep doing that.
Interesting.
Yeah, it's really cool. And then if
like
the brain does what we don't, yes, exactly. Yep. And so if the brain's doing what we don't want it to do, right? If it's overproducing this brainwave that we're trying to calm down, then the car does not drive in the middle of the road. It kind of drives erratically down the road, and the picture doesn't look, the car's not driving in a smooth manner, which the brain does not like. And so as we go, we're actually helping the brain create neural pathways. And so the brain starts learning, oh, I actually like it when the car drives down the road smoothly. I'm going to keep doing that. And so after a while, we can adjust thresholds to go lower and lower if we're decreasing brainwaves. And that's how the brain kind of learns and then holds on to what it has learned, which then results in decrease of symptoms.
Will you define neural pathways for me?
Yeah, so neural pathways, I like to use an analogy so neural pathways are the way that the brain sort of like connective roads, right? So I like to think of it as like if you are walking down a dirt road or a dirt field, the more you walk down that same path, the more that path starts looking like a road, right? Because you're using it and you're walking down it, and it's maybe if there's grass, the grass is starting to look tamped down, and so you're basically creating a road, right? And then you can remember, oh, this is the road I walked down. I've done this before. And so I like to think of neural pathways as that. The more you use this road, the clearer the path will become. And so when we're thinking about neural pathways and what that looks like in the brain, it's essentially a way to kind of reinforce what we're learning, right? So we're connecting dots basically and teaching the brain it's actually okay to keep walking down that dirt road. You don't have to try to create a bunch of different roads and see what's going to happen next. You have a predicted pathway.
And with neurofeedback, can you talk more about who would be best served by this, or what challenges people are facing would be best served by this, how long it takes, the usual questions we get from clients about any therapeutic process.
Yeah. So I am biased and think everybody can benefit from neurofeedback. But I think the biggest sort of things that we see in our practice are things like anxiety, treatment-resistant depression. So if people are not feeling like their depression medication is working, neurofeedback really can be super helpful. We see a lot of people on the autism spectrum, both kids and adults. People with an ADD or ADHD diagnosis come to us. People that have experienced traumas, right? So people with a PTSD diagnosis, sensory sensitivity, we see a lot of. So I hate to say everything because it's not really everything, but most things that you struggle with can be helped in some way with neuro. So even like struggling with relationships at home, right? A lot of our couples, we will say, hey, one or both of you, what do you guys think about trying some neurofeedback sessions? Because what it can do is it can also help increase distress tolerance. So if we can increase distress tolerance, then we can do some really good work in therapy because we're not going back to regulate as often. So yeah, it's huge. And you know, we start at age 6 and go all the way up to like, 99. So there's not really an age limit or tons of limits, right? I mean, it's not helpful for like schizophrenia or schizoaffective, bipolar, things like that. But really, most of the things that we see our clients struggling with in the room, no matter what your specialty is, they can benefit most of the time.
Can you speak more to how balancing out those brain waves is beneficial? Like what it's doing within the body and what it's hopefully creating as an outcome?
Yeah, so what we're teaching the brain to do is we're teaching the brain to sort of self-regulate, right? So for example, one of the brain waves that we look at is called alpha. Alpha is the brainwave that makes us feel calm, relaxed, and focused. And so if we have too much alpha or not enough alpha, you're going to feel the same way, which is usually anxious, right? So you're not feeling calm, you're not feeling relaxed, you're kind of feeling a little bit maybe panicked often, right? And so if we can increase if you need more or decrease if you need less, the theory behind that is that if the brain knows the amount of the brainwave that it needs to produce, it will help your nervous system regulate. It will help you decrease that feeling of anxiety, right? Same with some of the really fast brain, like we have a set of brainwaves that we look at called beta. Within beta, there's a frequency from 12 to 15 hertz that deals a lot with emotion and mood regulation. And so, sometimes for distress tolerance, we'll increase that because we find that oftentimes people don't have enough of that one. Kids will come in with like really big emotions or have a difficult time kind of regulating themselves, right? Throwing really big tantrums or having these huge outbursts at home. If they're low in that 12 to 15, we'll increase that and the symptoms start subsiding. So people usually start seeing change within 8 to 10 sessions, which is also really cool because that is so much faster and sooner than medication. People can oftentimes during neurofeedback get off of their meds completely or at least be able to reduce their dose. And so I know a lot of parents don't want to medicate their kids. So I feel like neurofeedback is a super great alternative to that because we're not doing anything invasive and we're just helping the brain learn that it's actually okay to have more or less of this brainwave. Nothing bad will happen if you have the correct amount of alpha or, beta or something like that.
Oh, cool.
And now, is this something that someone has to do lifelong, or when can they stop? Are the changes sustainable?
Yeah, so the changes are sustainable because we are creating those neural pathways, right? So once the brain makes the path down that dirt field that we talked about earlier, it stays. It learns, it holds on to it, and it stays. I mean, barring like a traumatic brain injury or something like that, we can't guarantee. But luckily, neuro is great for TBIs too. So we can always come back and do more neuro if we need to. But it's not a lifelong thing. So it's in our practice, it's a total of 30 to 40 sessions. Some people need less than 30, some need more than 40, but on average, it's in that 30 to 40 range. And then you're just done. So there's no touch-ups, there's no maintenance, there's nothing that you should have to come back to neurofeedback for, unless it's like, a different issue that you discover years down the road or something, or you're like, oh, maybe anxiety was an issue before, but I'm ready to just kind of tackle it now. So that's the other cool piece of it, is it's not lifelong. Once you're done, you're done.
How long are the sessions?
They are 45 minutes. So we do 30 minutes of actual neurofeedback training. The other 15 are used for like checking in and looking at progress and, just kind of talking about things that are being noticed or not.
I want to go back to when you talked about who it's appropriate for, and you talked about age.
Yeah.
And I want to talk about kids in particular, because I know having talked to you outside of, this episode, you're very conscientious of how the brain develops and what that means with, using neurofeedback on a child. And I was hoping that you could share like a case or something like that of how that works, if that makes sense.
So, yeah, I mean, most of our population at the practice is kids. I would say we see a lot of kids that are, I'd say probably between 8 and like 11 or 12. That's kind of like the core big kid population. But in terms of how the brain develops, it develops from the back to the front. And so oftentimes we'll do the brain map, and for kids, we'll train kind of the back of, the occipital lobe, the back of the brain. And that's because that's kind of the most developed part of the brain. And so we can still tackle lots of symptoms by just training the back of the brain. If we need to, we'll train other parts, right? Because we look at that map and look at the data that's on there. But oftentimes we start at the back and go to the front, because that's how the brain develops. And so, there's just so much, it doesn't make sense to train parts of the brain that aren't super developed yet, right? Unless we absolutely have to. The
reason why I asked that is because I feel like I wanted to highlight to people listening that this isn't just hooking up with electrodes. There's a lot of knowledge and research and insight of how this goes into there.
Yeah.
And unfortunately, like any therapeutic practice, there's probably something out there that isn't, doing it in the way that they're supposed to.
True.
Yep. Yeah. I mean, there are, the important thing with neurofeedback is finding somebody that's board certified, because that person has gone through trainings and classes and taken a really big exam to make sure that they know what they're doing. There are places that just do like what we call blanket protocols. So, maybe everybody with anxiety got the same protocol, and that's not, I mean, I guess it maybe can work, but I don't know that it's beneficial for everybody, right? Because when you've got like a kid in the office, they might be displaying some hyperactivity or something like that, but maybe it's more attachment related than ADHD related. And so we'll need to kind of look at that underlying, like the underlying history, right? If you've got a kiddo that's been adopted, we should probably look into some trauma and some attachment rather than just throw some electrodes on their head and be like, great, let's use anxiety protocol. I think it's really important to find somebody that does EEGs so that we can also see exactly what's happening in the brain. It's important to know that all of the brain waves function best at a specific threshold. And so pushing brain waves above or below their thresholds is also not going to make you feel very good.
And Tanja, you had the experience where somebody has maybe gone and done a blanket protocol and they've had to come to you to, I guess, fix. I don't want to say that language, but actually use this more individualistic approach because it didn't work for them, and now you have to go in and individualize it for them.
Yeah, unfortunately, we have had that happen. Or people will say, they'll call and say something like, I know you do neurofeedback. I'm not interested in that. I just want talk therapy. And so we do some research into them, right? And find out that they had a really terrible experience because it either didn't work or something bad, like they just didn't feel good, right? And so I know recently we had a poor little 10-year-old little kiddo that came in that got a blanket protocol, and things seemed to be working really well in the beginning. And then all of a sudden he was just not feeling well. Mom was kind of worried because he started having some passive suicidal ideation and things like that. And so I know it was so sad. We did our brain map and found out that, whoa, we should be training something completely different than what this other place was training. And so, mom thankfully gave us a chance and let us do our thing. And, now this little boy is like functioning great. He's doing very well, able to sleep at night, and his sort of, passive SI and existentialistic thoughts are no more. So, it can get a little bit dicey. And I think the biggest thing is find somebody that is board certified.
It's fascinating how it's this like marriage between mental health and medical, and how it can have such a profound physical impact, not just a mental health impact.
And it's interesting because in my head, I'm thinking, and I've referred to because we're all in the same state. Luckily, I've referred to Tanja, and I typically refer men because I'm like, well, they don't want talk therapy, and they just want something that they can, fix. And typical, not all men, right? But I think it's a great alternative, and especially with the anxiety and distress tolerance is a big one that I refer to for the neurofeedback, because you really can't do couples work or these other things when that keeps coming up. I mean, there are other approaches, but neurofeedback seems to be one that keeps holding strong long term.
Yeah,
Tanja,
I mean, I think.
Go ahead.
I was just going to say it is a great modality for men, especially because I find too that men want hard data, right? Like I need to see the numbers. I need to see that this is working. Yep. And so for us, we can give people that. And so that's the other thing that is just kind of cool about it, right? Like there is tangible change that they see and then that we measure. So yes, Greg, I agree with you that for men,
I just knew for myself, I was like, I'm going to be there soon. So, and I guess that's a question I have too is, does this always have to be done in person? I'm assuming.
In our practice, it does. Yes. There are some places that will do like take home systems, which, to be completely transparent, I do not know much about. But in our practice, everything is in person. I like it that way because we can adjust the thresholds in real time, which is pretty cool.
And would you say that the take-home systems are probably the blanket protocols, or?
I actually am not sure. I don't know, to be completely honest. I haven't really looked into them because most of why that is because I like the human face-to-face interaction. I also feel like, if you are coming to me for neurofeedback, I want to build that rapport so that if we do need to continue counseling afterwards, you have somewhere to go and you're not feeling like, oh, now I need to find a therapist, right? And tell my story all over again because
Right.
this person doesn't know me.
Yeah. Good points.
When we talk about the therapy world, right? Often what comes up is EMDR. Can you speak to some differences between those two different modalities?
So neurofeedback works with the brain directly and those neural pathways, right? Whereas EMDR and neurofeedback go very well hand in hand.
Mm.
We will have a lot of our clients doing neuro and EMDR at the same time because with neuro, again, right, if we can increase your distress tolerance, we can get into some really deep EMDR much quicker than we could have without the neurofeedback present. And so with EMDR and neuro's more brain focused, whereas EMDR deals a lot more with like how do I want to say this? Sort of like the residual effects of the trauma, right? The emotional pieces and the maybe avoidance and things like that. So neuro kind of opens the door for you to be able to work through some of the things that EMDR shut the door on.
Interesting. Yeah, and I know EMDR is more of, it's theoretical of what's happening in the brain. They're not really focused on like output from the brain. And it's more of having you do bilateral stimulation, theoretically is kind of their theories driving this, but they're using bilateral stimulation, whether that's tapping or pulsometers, to kind of get this left-right brain activation while processing, which is different what you're saying, because you're talking about actively adjusting waves.
Yeah, right. We are looking at how is the brain functioning at its core, right? And so how can we change that and make it function more efficiently?
And then are there people that you would not suggest that this would be helpful for? I know earlier you talked about, schizophrenia. Is there anything else, any particular?
So schizophrenia, bipolar, there's not tons of research on. We have some clients that have been diagnosed with bipolar that have gotten some relief with neuro. And then things like schizoaffective, it's not super helpful for, right? But everything else, I always like to tell people outside of the major mental health, right? Like schizophrenia and bipolar, if it requires a medication, we can usually help with it.
And do you have knowledge of or how this either works in hand with, say, like ketamine assisted therapy, where they too are like theoretically something's happening in the brain?
Sure.
Have you noticed clients that have done that and you've seen something with the waves or?
Yeah, so that's actually really new research. There's research that they're conducting now on CAP and neuro. So we actually haven't had any clients come to us that are actively doing CAP. We've had a few that have done ketamine in the past and then are coming to neuro, or we've had some that have done neuro, finished their protocol, and then did a little bit of counseling and then moved on to ketamine. So I haven't done it yet with anybody in conjunction.
Yeah,
It'd be
that's
interesting to marry the two.
Yeah.
Can you speak more, Tanya, to how this can be beneficial to relationships?
Yeah. So in relationships, for the first thing I think of is distress tolerance. If we can increase that, so much of the other stuff decreases, right? Like sometimes even arguments, right? Or even just relationships at home between kids and parents. If kiddo is doing neurofeedback and we're, working on whatever it is, anxiety, let's say, if symptoms of anxiety are decreasing in kids, we're probably also decreasing outbursts or however their anxiety presents externally. And so when that happens, things get better at home, right? Because there's less conflict. In couples, it goes back to distress tolerance. And also, I've had some couples where one partner is just super sensitive to sensory stuff, right? Light, sound, textures, all of that. And this particular case that I'm thinking of, it was causing so many issues in the relationship because this person wasn't aware that they were having sensory like reactions, right? She would get super angry and kind of yell at her partner, and distress tolerance was low, and everything felt kind of like, as she described it, a mess. And so we started neuro specifically focused on the sensory, and that, I don't want to say, drastically like made things better. We were doing a lot of work in couples too. But as soon as we got some of the sensory under control, she was able to handle a little bit more, even in our sessions. And so, because we were able to get in there and actually do the therapeutic, like the talk therapy work, they're not in couples therapy anymore, and things are going really well. She'll send me a check-in every few months and just say, hey, things are good. Just wanted to let you know. And so, if we can kind of repair some of those, I like to think of it as like repairing some of those big outbursts that push people away rather than bring them closer. I think that that's a win, right? If nobody is ever going to fight perfectly, right? And nothing's ever going to be so great at home all the time, 24/7. But if we can decrease some of the big emotions that are happening because people are overwhelmed or whatever's going on, then we can bring them closer rather than keep them far apart.
That's interesting. And as you're talking about that high sensitivity, I think of HSPs in one, a highly
Yes.
sensitive person. And
Yeah.
we've had a previous episode on this, but that falling under neurodivergence too, and how it can create relational issues.
Mhm.
So it's fascinating to hear how that can help soften almost that dissonance between someone who's neurodivergent and someone who's neurotypical.
Yeah. It's pretty cool. I like it because it's fast, right? Change starts between sessions 8 through 10. You come twice a week. So really that's within a month to 6 weeks that we're starting to already see things change.
We know we love our quick fixes here in America.
I love it.
What other insights or takeaways do you want our listeners to have about neurofeedback or finding a neurofeedback provider or anything in that realm?
Yeah. So, I mean, finding a provider is, I don't want to say easy, but if you can find board certified providers on the bcia.org website, all of us that are board certified are listed there. And so that's kind of where I tell everybody to start looking. It's unfortunate, most insurances don't cover neurofeedback. I know that Medicaid covers it. And Cigna will sometimes, depending on the plan, but it's insurance is kind of one of those difficult things when it comes to neurofeedback because they consider it experimental. It's kind of new, and so it's been around for a while, but new in terms of like the Western medicine field, right? And so insurance says there's just not enough research out there. So I would suggest getting on the BCIA website. You can find neurofeedback providers on Psychology Today. If you do that, I would just ask, are you board certified in neurofeedback? And as far as takeaways go, I think you have to be open to it, right? Just like any other therapeutic modality. But I think if you give it a chance and give it those 10 or so sessions to start seeing change, I think it's a great tool, especially if you're looking to not medicate or at least reduce meds, if not come off of them completely. It's a good sort of holistic approach to mental health.
Love that. And we'll have these resources for you guys listening on our podcast or on our written up.
And we'll include Tanya's contact information as well and her practice information. So if you live in Colorado and this is of interest to you, it might be worth checking into. It's fascinating, right? Anytime we can offer options, I talk about it like a buffet, right? Offer a buffet of options to people who need mental health support, all the better. And this is an incredible option.
Yeah. And even though insurances don't like it, there is a lot of research on this, just not a lot, according to insurance, but
Yeah,
it's impressive.
they want more, right? They always want more.
They always want more.
Yeah.
And so I think, it's not like it's an unresearched modality. There's tons of research out there, but as far as insurance goes, it's just not enough.
Yeah.
Mhm.
So by definition, it is evidence-based for anyone listening, which means there's
It is.
evidence that it is, effective. And in certain, you'll even see studies and where it's been tested with ADHD or anxiety. And so you'll find that even with some of the resources that you'll see on our site or page.
Well, thank
Well,
you,
and
Tanya. Oh, go ahead.
Yeah, you're welcome. I was just going to say the American Academy of Pediatrics gives neurofeedback a level 1 intervention for ADHD, which is the highest
Yeah.
Wow.
rating. So, it does work. I think insurance just needs
It's
more.
insurance.
Is
I
insurance.
actually don't know what they need.
It's insurance. We're trying to protect our money.
Yes.
Well, thank you so much, Tanya, for joining us
Yes, thank
today,
you.
where we talked about neurofeedback.
Yeah, thanks for having me.
It's such an incredible resource available to our community. And it sounds like finding the right provider is easy-ish, but making sure you do find that correct provider. We've talked about in here how important it is to make sure that if you're looking for specialty care, really checking the credentials and the training of the person you're working with.
Yeah.
Thank you so much, Tanya, for coming today. And as always, if anyone has any questions for Tanya, for us, topic suggestions, feel free to email us at relationshipsinsideout@gmail.com. Thanks.
Thanks.
Thank you. Thanks.